Hi, my name is Dr. Charles Feinstein. Thank you for coming to my office. We're located on Lakeshore Drive in Chicago on 4700 North. That's Lakeshore Drive in Lawrence. Our phone number is 847-291-9058. That's 847-291-9058. And we specialize in problems with the bladder control for men and for women. We have, for your convenience, 4 nurses with us full-time all day long who speak beautiful Polish, and they are here to help us, to help you, and they're here for your convenience all day, every day.
Doctor, what is urinary incontinence?
Urinary incontinence is a problem that is very common in America. It affects 30 million women, and it's simply where the woman, loses control of her bladder, and the urine comes out without control.
Is it all the same, or are there different types of urinary incontinence?
There are many different types of incontinence. The 2 most common types are called stress incontinence, and that means the woman loses urine when she coughs and sneezes, when she laughs, when she does any exercise, jumping up or down, when she rides the bicycle, does any trampoline, and the woman can also lose urine when she's screaming at her husband or screaming at the children. There's another type of incontinence which is called overactive bladder. And that means that the lady has to run to the bathroom in a big hurry, but she just can't get there fast enough, and the urine comes out before she gets to the bathroom.
Which types are handled by the medications?
The medications are very successful for only one type of incontinence, and that is the overactive bladder, where the woman has to run to the bathroom in a hurry, can't get there fast enough, and the urine leaks before she gets there. Medicines can help with that particular problem.
So which types are handled by the surgery?
The surgery is for the other type of problem where the woman loses urine when she coughs, when she laughs, when she screams at her husband, when she exercises, plays tennis, volleyball, soccer, when she tries to run or do the treadmill, and she's losing urine when all of those muscle activities, those physical activities, and for that type of problem we have a surgical procedure which takes 15 minutes, very successful.
Are there times where both medication and surgery are needed on the same patient?
That's a very good question. Yes, there are. Many women have both problems at the same time, where they have the overactive bladder, running to the bathroom in a big hurry, but they also lose urine every time they cough and sneeze and when they lift up a bag of heavy groceries. So that can also be 2 problems at the same time, and they would require both treatments at the same time.
How many people in America have problem with urinary incontinence?
Almost everybody. There's at least 30 million women in America, and it may be even higher than that, who have problems with urinary incontinence.
So is incontinence only an old lady's disease?
Well, most people think that it's an old lady's disease, and as a matter of fact, urinary incontinence in old ladies is the #1 reason in America that women get put into nursing homes. However, my practice is different because we specialize in young women. Most of my patients are between the ages of 28 and 55, and they are having urinary incontinence, and they've had it, some of them, for 15 years before they come to see me.
Is there any benefit from physical therapy?
We find that physical therapy is an excellent treatment. We use it in combination with the surgery, and we also use it in combination with the medicines because it makes the muscles stronger. And if we can make the muscles stronger in the female pelvic region, we'll have better results.
So what are the pelvic exercises?
The pelvic exercises are exercises that are specially designed to prevent the organs inside the woman from falling down and from falling out. The bladder can fall down, the uterus can fall down, the rectum can fall down, and the pelvic exercise physical therapy that we teach helps the muscles to strengthen so that those problems where the organs fall down can be avoided.
Can you briefly describe the surgery for urinary incontinence and how does it work? Should the woman be afraid of it? Because I think this is like the common question.
Well, everybody is always afraid if you mention the word surgery, so we don't mention surgery. We call it a procedure, and it takes 15 minutes. It's an outpatient procedure. We do it in our office. You come in, we get you ready, we do the procedure. It takes 15 minutes, and at the end you stay another hour or so, you go home. By the next day you're able to drive, and you're able to do almost all of your normal activities the very next day after the surgery.
Do you use anesthesia during the surgery, or the patient can be awake?
We usually use anesthesia, but we don't have to. There are some patients who prefer to be awake, and that's perfectly okay. We don't mind, but most of our cases have anesthesia because I don't like any patients to feel any pain at all.
Some women say, I feel like something is falling out of my bladder. Is it incontinence?
Incontinence is when you're leaking and when you're wet. When there's a problem of organs falling down, that's a separate problem, and it frequently happens at the same time, either with the incontinence or without the incontinence. But the bladder can fall down, the uterus can fall down, and the rectum can fall down, and they can all come through the pelvic area and can become a very big problem.
So why does the bladder prolapse happen?
The bladder prolapse is very frequent after hysterectomy, when they take out the uterus, and that weakens all the muscles, and once they weaken the muscles from the surgery of the hysterectomy, everything falls down.
Is it treatable?
Well, yes, and if it falls down enough, we have to lift it back up and lock it into place, and that requires a surgery. Hi, this is Dr. Feinstein. I'd like to thank you for coming and listening to us today. My office is located on Lakeshore Drive in Chicago on 4700 North, and that's Lakeshore Drive in Lawrence. My phone number is 847-291-9058. That's 847-291-9058. We hope that you'll come and visit with us. We'd very much like to help you with any problem that you may have. And for your convenience, we have 4 nurses all day, every day, who speak beautiful Polish, and they're with us to help you and make your experience much more enjoyable.